You ready to get started?
Okay.
So when you receive the kit, you'll open up the box like this, and you'll notice that in the front of the box is a trainer, and behind that you have 2 of the actual auto injectors.
They're so small.
Exactly. The actual auto injectors are bright yellow and purple, but the trainer is black and white and has no real medication. And of course it says trainer so that you can't mistake it for a real auto injector.
So that's just a fake one to practice with.
Yeah. Now, don't go anywhere without this kit. You never know where you might need it. Now, you already went over the signs of overdose with Dr. Watkins, right?
Yep.
Yeah.
There was no or slow breathing.
Bluish or grayish lips or fingernails, and pale or clammy skin.
That's exactly right. Okay, so if you see those symptoms, the first thing you'll do is open up this kit and administer the naloxone. Then you're gonna call 911 and tell them what's going on. So let's go ahead and get started with the trainer and get you familiar with what to expect.
Sounds good.
Okay, you ready?
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete. This trainer may be reused for training purposes. Replace the red safety guard and white outer case.
There you go. So the battery in this trainer is good for over 1,000 uses. So anyone who might need the practice should use it.
But wait, why are there 2 of the real auto injectors?
Well, that's a great question. If the person doesn't respond to the first dose within 2 or 3 minutes, or if they seem to get better but go back into overdose, like if breathing resumes but then stops again, you need to give them another dose using the second auto injector. And also, it's important that if you do end up using your kit, that you let your provider know and request a new kit. Now, your provider will want to make sure that you're okay and evaluate whether changes to your treatment might be needed to keep you safe. Any other questions?
No. Makes sense. I'm hoping we don't have to cross that bridge.
That's for sure.
Yeah, and we hope so as well. Well, while I've got you here, why don't we read through some of the instructions together?
That'd be great. Thank you.
Indication. What is Evzio? Evzio is a prescription medicine used for the treatment of an opioid emergency, such as an overdose or a possible opioid overdose, with signs of breathing problems and severe sleepiness or not being able to respond. Evzio is to be given right away by a caregiver and does not take the place of emergency medical care. Get emergency medical help right away after the first dose of Evzio, even if the person wakes up. Important safety information. What is the most important information I should know about Evzio? Evzio is used to temporarily reverse the effects of opioid medicines. The medicine in Evzio has no effect in people who are not taking opioid medicines. Always carry Evzio with you in case of an opioid emergency. Use Evzio right away if you or your caregiver thinks signs or symptoms of an opioid emergency are present, because an opioid emergency can cause severe injury or death. Signs and symptoms of an opioid emergency may include unusual sleepiness, and you are not able to awaken the person with a loud voice or rubbing firmly on the middle of their chest, sternum. Breathing problems, including slow or shallow breathing in someone difficult to awaken, or they look like they are not breathing. The black circle in the center of the colored part of the eye, pupil, is very small, sometimes called pinpoint pupils, in someone difficult to awaken. Family members, caregivers, or other people who may have to use Evzio in an opioid emergency should know where Evzio is stored and how to give Evzio before an opioid emergency happens. Get emergency medical help right away after using the first dose of Evzio. The signs and symptoms of an opioid emergency can return within several minutes after Evzio is given. If this happens, give additional injections using a new Evzio auto injector every 2 to 3 minutes and continue to closely watch the person until emergency help is received. Who should not use Evzio? Do not use Evzio if you are allergic to naloxone hydrochloride or any of the ingredients in Evzio. What are the ingredients in Evzio? Active ingredient, naloxone hydrochloride. Inactive ingredients, sodium chloride, hydrochloric acid to adjust pH, and water. What should I tell my healthcare provider before using Evzio? Before using Evzio, tell your healthcare provider about all of your medical conditions, including if you have heart problems, are pregnant, or plan to become pregnant. Use of Evzio may cause withdrawal symptoms in your unborn baby. Your unborn baby should be examined by a healthcare provider right away after you use Evzio. Tell your healthcare provider about the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Evzio? Evzio may cause serious side effects, including sudden opioid withdrawal symptoms. In someone who has been using opioids regularly, opioid withdrawal symptoms can happen suddenly after receiving Evzio and may include body aches, fever, sweating, runny nose, sneezing, goosebumps, yawning, weakness, shivering or trembling, nervousness, restlessness or irritability, diarrhea, nausea or vomiting, stomach cramping, increased blood pressure, and increased heart rate. In infants under 4 weeks old who have been receiving opioids regularly, sudden opioid withdrawal may be life-threatening if not treated the right way. Signs and symptoms include seizures, crying more than usual, and increased reflexes. These are not all of the possible side effects of Evzio. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. See www.evzio.com for full prescribing information.